I'm going to talk about an initiative I've been involved with actually at a national level as a medical student. My name is James, by the way. I'm a medical student in Leeds. And while we're doing that, I'm going to give you a chance to do some basic life support, which is what we've been training people in. But we're going to do that virtually. It's the first time I've done it virtually. And we've got some clever gizmos that we're going to play with to see if it works. So we'll see how that goes. So I'm just going to share my screen with you now. Brilliant. Can someone just confirm that you can see my screen? Is that... Someone's posting the comments. Fantastic. Thank you very much. Brilliant. Okay. So we're going to talk about CPR. We're going to talk about saving a life, but we'll come back to some more details on that in a minute. So what I'm going to talk to you about is World Restart a Heart Day. And specifically, I'm going to talk to you about medical students being involved in this public health initiative that's been running for a few years now. So I've talked here about medical students because I'm a current medical student, but I think this applies equally to all healthcare students, really. And I'm sort of conscious that I'm speaking to an audience of aspiring healthcare students. So I wanted to kind of take the opportunity to talk to you a bit about how you can contribute to public health as a student in whatever healthcare discipline. So I suppose for most of us as medical students, our clinical learning we really think of as centred around clinical settings. So we go into hospitals, we go into GP surgeries, and this is where we interact with patients, we develop our communication skills, and we over time start to be able to contribute to those patients and their well-being. I would kind of pose a question to you though, which is, do our professions, whether that's nursing, medicine, dentistry, or any other professions, do we have a responsibility to promote the health of the population outside of these clinical settings? For example, in their day-to-day life, and I think most of us would agree that we probably do in some way. And so it follows that as future clinicians, as healthcare students, we have a responsibility perhaps to promote good health outside of these settings. And actually, while you're a student, there's probably an opportunity for you to make more impact in public health initiatives than there is necessarily in the clinical environment where you're still quite new and learning those things. What's to have that we can contribute to these public health initiatives? Well, as students, we've got quite a lot of time. There's a lot of us, so we can contribute at scale. And you know, if you think about today's event, a lot of this has been brought together by students. So sometimes the word student, people think you can't achieve much, but actually groups of medical students achieve wonderful things across a huge range of initiatives, and we're going to talk about one of those now. So thinking back to public health initiatives, can you think of some topics, apologies for the typo, can you think of some topics where medical students can contribute to public health? If you've got some ideas, post them in the chat, we'll have a quick look. Developing immunity, okay. Do you want to put a bit more about that, Jacob? So examples I can think of is educating the public. So we could go out and we could talk to people about a whole range of issues. So Megan's touched on that idea there. So we could talk to people about you know, their cardiovascular health. We could talk to people about exercise. Medical students often involved in kind of quite specific things. So what I'm going to talk today is our involvement in training the public in CPR and basic life support. But before we do that, what I'd like you to do is download this app, and we'll come back to use this later and have a bit of a play with it. So this app is called TCPR Link. If you go to the App Store, then you should be able to download it now. I'll give you a couple of minutes to do that. Alternatively, if you type into your address bar tinyurl.com/TCPR app, then you should be able to get to it from there. So if anybody will give it, and you can keep playing around with that as we go, but you should find it looking like this on the App Store, and click open. If you haven't got access to a device to download this, then don't worry, but it's just something we're going to have a go with at the end. So if anybody's managed to download that, please let us know in the chat. Well done, Jacob T. Okay, thanks everyone. Brilliant. So just leave that to one. Back to that in a minute. So I talked about public health initiatives, and I talked about the fact that actually as medical students we're really well placed to address some of these. So I'm going to talk to you about one of those, which is sudden cardiac arrest and bystander CPR. Okay. So and this is the initiative I've been working on. So sudden cardiac arrest is when somebody collapses and the heart stops beating. It's different from a heart attack, and if somebody has a sudden cardiac arrest, they'll be unconscious, their heart's not beating, and without some intervention, that person will die. Okay. It's very common. Tens of thousands of people are affected by sudden cardiac arrest in the UK annually, and for most, or for some people who have a sudden cardiac arrest, particularly if they have a precipitating event, so they have a massive heart attack, or they're playing tennis, for example, and they collapse, then actually we can do quite a lot to help that person survive. But what that does is it relies on bystanders. Okay. Currently, less than 1 in 10 people survive an out-of-hospital cardiac arrest in the UK. But we know that if they get bystander CPR, so chest compressions, and defibrillation using a defibrillator that you'll see all around in public, that can often triple the chance of survival. Okay. We also know that without those interventions, the outlook is pretty bleak, and we know that, for example, for every minute that somebody doesn't get a defibrillator, their chance of survival goes down by 10%. Often when someone collapses, people think that it's going to be the paramedics or the doctors that save their life. And there are some sort of advanced interventions that we can provide. But actually, if somebody collapses out in the streets, their biggest chance of survival lies with the people around them, the bystanders, the normal members of the public, because they're going to be able to do things like CPR that can really make a difference. Currently in the UK, CPR rates are very low. Only 30 to 40% of people who have an out-of-hospital arrest receive bystander CPR. And if you think that it takes 8 minutes for an ambulance to come, then without bystander CPR, chance of survival is very low. We know that a third of the population reported last year in a study by the Resus Council that they wouldn't have the confidence to attempt CPR if a stranger collapsed in front of them. So the initiative we've been doing is really about increasing people's confidence to perform bystander CPR. And so just to emphasise this, the Department of Health said in 2013 that over 1,000 lives could be saved each year in England if more members of the public were trained in CPR, and there was earlier access, greater access to, and greater willingness to use public access defibrillators. So there's a common device which I'm going to introduce when someone has a cardiac arrest. That comprises of a number of links in the chain. The 4 I've got here and call for help. Early CPR, which is pumping the blood to the brain. Early defibrillation to restart the heart. And then advanced post-resuscitation care, which is what we provide in an ambulance or in hospital. Now, in 2018, this model was kind of reworked, and you can see that the rings in this model are different sizes. So the size of the ring is the number needed to treat, so the benefit of each intervention. So you can see that actually it's those early links in the chain, which is what the bystanders do, that really makes a difference. So there's been a project that we've been Restart a Heart Day. It takes place every year on the 16th of October. Just out of interest in the chat, has anybody something you've come across in your school? Jacob T has heard of it. Brilliant. Well, I'm obviously preaching to the converted. So some of you have, some of you haven't. I'll tell you a little bit more about it. So it's a project that's led by the Resuscitation Council UK. It centres around a day in October, and the aim is to try and increase the number of people who are willing to perform and know how to perform CPR and also use defibrillators. So for the first few years of Restart a Heart, the ambulance services across the UK were really involved in this, and predominantly they were delivering training in CPR to young people in schools. And this is a great example we talked about before of how actually you can make more of a difference sometimes outside of the clinical environment. So what was happening is paramedics and ambulance crews were volunteering on their day off, and they were going into a local school to teach CPR. And so that the ambulance service were involved, the British Heart Foundation, St John Ambulance, the British Red Cross were involved. And in 2018, for the first time, 4 medical schools were invited to participate. So Leeds, Birmingham, Southampton and Bristol, we all took part. What we did is we delivered student-led projects where we took medical students and we went out into our local communities and we taught the public CPR. So we had sort of big events in the city centre. We also taught across campus. And in that year, from 4 medical schools, we trained over 3,000 people in how to perform CPR. And that was really successful. So last year, we expanded and we had groups from 13 medical schools. So that was 482 medical students across the UK. And we trained about 7,500 people in CPR. Okay. Now, if you look at the wider initiative with the ambulance services involved nationally, nearly 300,000 people were trained in CPR. And what we've seen over the last few years is a gradual increase in the rate of CPR, bystander CPR, and actually slowly we're starting to see changes in survival throughout hospital cardiac arrest. So these sort of initiatives to raise awareness of CPR in the general public are starting to make a difference, we think. Has anybody here done any first aid training? Just to kind of to ask the question, post in the chat if you have. Lots of people saying yes, that's great. A lot of you will be used to a first aid course where you go and spend an hour or two in a classroom. There's a lot of talking, not much practical stuff. That's great. But one of the challenges that is people get a bit disillusioned, and there's a lot of telling people, oh, you can't do this, and in this situation you have to make sure you do this. And the concept of that is that CPR is often perceived as something by the public that you can't do unless you're trained how to do it. But actually most people who perform bystander CPR have never done any CPR before, have probably never done any CPR training. And actually we know that the ambulance call handlers can talk you through CPR down the phone, and it's not hard to do it. Now, when we train to do CPR in hospital, we have quite specific ways that we learn to do it. But actually, if a member of the public's doing CPR, we know that in a cardiac arrest, really anything is better than nothing. And the worst thing they can do is not try CPR because they're worried that they might not quite do the right breaths to compressions ratio or something like that. So what we did is we taught really simple CPR. And we taught hands-only CPR. We kind of left the mouth-to-mouth bit out because increasingly the guidance for the public is saying that that's less important. We know that that puts people off doing CPR. And we also gave people a chance to practice using a defibrillator. So you can see here 2 medical students teaching a member of the public, this is in the university, how to use a defibrillator. And actually they're not even telling him how to do it. What they've done is passed it to him and said, open it up and follow the instructions, because it's that simple. And really what we were trying to do here was encourage people to be confident, to know that in this situation they could open the AED. The hardest thing was turning it on, and then it would tell them what to do. And you can probably all think of locations near where you live, near school or college, where there are public access defibrillators. And I'm sure, if needed, any of you will be able to use that, even if you've not had any training. And what we try to do is teach people in 8 minutes, because, you know, if they're busy, that's 8 minutes of their time when they can learn CPR, because it is that simple. I'm conscious some of you have come here today because you want to learn CPR. Some of you probably have already. So we're going to do that towards the end. But what we're going to start by doing is just talking a little bit more about why this project was so useful. And I think it was probably because it for the communities, you know, we're training people in CPR, but actually there's a value for students in taking part as well. So I don't know, a lot of you have had some CPR training. I don't know if any of you have been involved in CPR training initiatives where you go out and deliver training. But what do you think the benefits are for medical students of being involved in a public health initiative like training people in bystander CPR for Restart a Heart? So have a minute to think about it and post what you think in the chat, and we'll have a think. So what are the benefits for students of giving up their free time, they're busy people, to go and train members of the public in how to perform CPR? Okay, so we've got some great things coming through here. So Jacob says it builds communication skills that will be relevant to working with patients. Niles also talked about communication skills. Leah said they start promoting health. Brilliant. I think you've stolen everything I'm going to say. Waiting times decreases reliance on health. That on its head a bit, but it's about empowering. Teaching experience looks great on your portfolio. That's true. Helps to consolidate understanding. That's really interesting, actually. We surveyed all the students that took part in this project in Leeds, and actually they all said that they felt more confident to perform CPR themselves through having taught something. So if anyone's got any experience of teaching, you'll know that the moment you teach something, you're often more confident to do it as well. Brilliant about increasing survival from cardiac arrest, ultimately. community-based health promotion, trust, communication. Brilliant. So you can see that actually, although on the face of it, this is a project about CPR, actually what it does is it provides students with experience teaching in the community. And the medical school who supported us with this. For them, I suppose CPR was very much a vehicle through which we could provide students with teaching experience, through experience communicating with the general public. That can be quite challenging sometimes. Often as a student on placement, you're not so much taking the lead in the communication because you might be sitting in a clinic with a doctor. But actually, if you're delivering one-to-one teaching, the communication skills that you're developing there are probably easier to develop at your junior stage than they might be in a clinical setting. So lots of benefits to be had. From the public's perspective, this was really about improving confidence. Competence is important. We don't want people performing really fast CPR where they're not pushing hard enough, for example, because that doesn't work as well. But actually, this was about giving people the confidence that they could have a go. And you can see here there's some very crude data where we surveyed everybody that we taught in Leeds, how confident they were before the training and how confident they were after. And you can see that if they go away with a 4 or a 5, either they're confident or very confident, then if they find themselves in that situation, they're going to be much more likely to provide that life-saving CPR for those vital minutes before an ambulance comes. So that was really, really encouraging to see from our perspective. We've just, we're midway through a qualitative research project, which has taken a bit of a pause due to recent events, looking at what students benefit from taking part in these community teaching initiatives. And I think these are things that a lot of you have just come up with in the discussion, really. So people want to kind of have the societal benefits of sharing their own knowledge, which is quite satisfying, of representing their medical school in the local community, impacting society ultimately through trying to improve survival from cardiac arrest, and actually being an active citizen in addressing local health needs. So, for example, in Leeds, what we did is we used postcode data from cardiac arrests, and we're trying to deliver our CPR training into the areas that traditionally have low rates of bystander CPR. So we're training the people where there is highest needs, which is quite exciting. But actually, you can see that almost there's more benefits to the student personally than there are to the wider society. So we mentioned that by consolidating learning through teaching, you might be better at performing those skills, certainly more confident to perform those skills. But also, teaching skills are very transferable. The way that you will deliver teaching if you become a junior doctor or a nurse to students is often not in a didactic lecture type setting. It's one-to-one teaching on the wards, short and sharp on the go between patients. So this is very similar to the teaching that we were delivering in the public. Confidence public speaking, confidence with communication skills. And then for the students who kind of led the project, because it was very much student-led in all 13 of those universities, there's leadership opportunities, there's enterprise opportunities, there's problem solving. So having to do risk assessments to go out into public spaces and things is something that you never get trained to do at medical school, but actually a useful career skills to have, really. And people talked about those things being useful on your CV. That's true, but it's also useful experience in general, really. So the Restart Heart Initiative has gone really well in the last couple of years in medical schools. We had a great plan to expand it to about 25 medical schools in 2020. And then, as a lot of you will know, a problem came along that has kind of impacted us in how that's going to go. So just have a little think. How do you think that, there's two questions here. How do you think that COVID-19 will have affected bystander CPR and the landscape around that? And how do you think COVID-19 will have affected the Restart a Heart campaign? And has anyone got any ideas about that? So 2 questions: impact of COVID-19 on the CPR and impact on the teaching CPR. What do you think? Post your comments in the chat. Okay, so we've got some great stuff coming through already. Brilliant. So this is exactly what I was hoping was coming out here. So there's two issues coming out, isn't there? The first is that because of COVID-19, generally the public may not be confident to perform CPR. There might be fear associated with breaking social distancing. Certainly things like providing mouth to mouth are very risk of transmission, and actually even CPR itself, chest compressions, is classified as an aerosol generating procedure by which respiratory droplets could be transmitted. So bystander CPR is probably going to suffer. And then a couple of you have also highlighted that actually in terms of teaching it, it's going to be difficult because we can't go and run mass teaching events like we were doing before because of social distancing. Could we teach virtually in the way that I'm delivering this talk now? I don't know. So there's a lot of issues there. And it's challenging to know which way to go. So just to summarise then, CPR is technically an aerosol generating procedure. And actually there's literature coming out now that says even in the last few months across Europe, we've seen a fall in bystander CPR rates. We've actually seen an increase in the number of out-of-hospital cardiac arrests. Unsure whether that's related to COVID or not. And with that, we can't necessarily attribute cause, the survival rate from out-of-hospital cardiac arrest has actually gone down. Is that because less people are doing CPR? We don't know, but it would be plausible that that will contribute. And although the risk of COVID transmission is important to bear in mind, it's also important that people are still encouraged to perform CPR where it is safe to do so. So actually, you can argue that training people in bystander CPR is probably more important than ever before. So long as we maybe train hands-only CPR, we don't do the mouth-to-mouth stuff, which we know is less important. If we train people to put a cloth over the patient's mouth when they're doing the CPR, CPR can be safe, but it can also save lives. So we really need to take things like the Restart Heart Initiative and put more gas into them than we ever have before, I would argue. The other thing to bear in mind is at the moment people are more likely to be at home. They're less likely to be in an office where there is a trained first aider. So actually the need for non-first aid trained members of the public to deliver bystander CPR is likely to be greater as well. So there's a bit of a challenge on our hands because we cannot deliver large scale public face-to-face training. What we need to do is change the content that we're delivering to reflect COVID-19 basic life support guidance, which is different to how we might respond in hospital, where we might be very, very conscious to have lots of PPE. That might not be available out of hospital to the general public. And we have to try and deliver that training in new ways. So can we deliver virtual CPR training? Well, that's challenging because CPR is intrinsically a practical skill. And what I can't do is stand here and deliver a lecture on how to do that and give you the muscle memory and the confidence to give chest compressions and things like that. There's a couple of solutions to this, though, that are really quite original. So I'm going to share some of those with you in this kind of final part of our talk now. What we'll do is we'll start by watching a video produced by the Resuscitation Council, which is all about, it's a public health initiative because it's delivered to the general public, and it's all about how they can perform CPR and give basic life support if they witness someone who's collapsed during the pandemic. And what you'll see watching this is that they've been quite resourceful to try and get around the fact that we might not necessarily have the same equipment that we have available in hospital. What we'll do after that is if you have got the app that I suggested download at the beginning and a cushion to hand, we're going to try and deliver some virtual CPR training. And then I'm going to show you some other VR apps and things that you could have a look at as well if you like. So let's start by watching the video. I'm assuming you can hear me speak. Otherwise, you've all been sitting waiting for a long time. So we'll have to just see whether you can hear the audio from the video that I play. Okay.
Every year.
Can anybody hear the track from Dr. Andy Lockey there? Fantastic. And play the video.
Hi James, Holly here. The video is locking up as we try to view it.
Okay, it's probably because I'm showing the video through
Yeah,
my screen. So what I'll do then is I'll post a link to the video chat, and if everyone watching, if you could just click on the video, I'll give you a couple of minutes to watch it, and then when you've finished watching, just type back in the chat that you're done, and then we'll carry on from there. That's probably the easiest way.
perfect.
Okay, so hope everybody's watching the video. I know it's about 2 minutes, so when you're done, just give us a nod in the chat and we'll carry on. Brilliant. Sounds like a few people have finished there, so I'll just hold on a second to let anybody else catch up. And we'll just have a chat about it. So I know some people have done some CPR training before. So what did you guys think about the COVID-19 basic life support training for the public? What did you think of it? What do you think of the video? Be honest. It was actually done in Dr. Lockie's front room because it was in the middle of lockdown. Do you think it was simple? Do you think it was complicated? Do you think it was resourceful? Yeah, Bisma says, way simpler than I thought it'd be. And actually, this is it. It is pretty simple. It's really easy. You just call for help if they're unresponsive, and then you probably cover their face over if you can with something, and then just give the chest compressions. Very simple, very memorable. That's great. Somebody asked, where can you find a public access defibrillator? So these machines, you'll find them in gyms, sports centres, but increasingly they're located outside in cabinets. When you call 999 and they identify that someone's unconscious and not breathing, they'll often direct you to the nearest public access defibrillator. So if you don't know where your nearest defibrillator is, your challenge when you're next out of the house is to find out where the nearest one to your school, your home, your work if you're working, find out where it is. And the key thing with the defibrillator, as you saw in the video, is you just open the box and you turn it on and it tells you exactly what to do. So the only part of the CPR training really that requires hands-on practice is actually doing the CPR. But we know that if you don't do very good CPR, so you don't push hard enough, you push at the wrong speed, it doesn't work very well. And the problem is lots of people watch CPR on casualty, where it's done appallingly, and they don't get to do it very well. So if you downloaded the TCPR app, this is where we're going to have a go with that. If you open that app up, and you can have a go at home if you don't get a chance to do it today, you should get a screen a bit like this. Thanks for sharing that link, Holly, that's great. And if you press the button in the middle, it will want to see your camera and your location. Let it do that. You'll see that it has a camera and then a little dial. And the great thing about this app is what it does is it detects movement. And from that, it will catch that you're going at. So all you need to do is, and this is where you see my empty room because I've just moved house, is put the app in front of you where you can see yourself on the camera, and you're going to kneel over a cushion. So I'm going to demo it here. And this is how we're going to give those chest compressions. Lock your hand in the middle of the chest, and we're going to push hard and fast like this. Nice locked out arms, going about 2 a second. And there's lots of songs that you can sing along to help you do this. So Staying Alive is the somewhat ironic one that's easy to remember. And we're going to push about 1/3 of the chest depth. And we're going to bring our hands all the way up every time so that the blood is being pumped to the brain. Now, if you're having a go on that app, hopefully what you'll see is the dial in the middle telling you if you're going too fast or too slow. So it doesn't tell you about the depth, but it does tell you about the speed. And the speed's the thing people often get wrong. So this is a really great system by which we can deliver online CPR training. And the other quite exciting thing is I can go online to the website for this app. And I can actually see all the people who are using this app at the moment. So this is all of you on my screen. There's someone in Fife. And I can see that they were doing CPR perfectly at the right rate, and then they went a bit slow, and then they probably got bored and stopped. One of you dialing in from Essex. Downloaded the app, but probably didn't have a go. But you can see that actually we could quite easily, and you have a number on your screen that matches up with what's here. There's somebody joining us from Brussels today who has done absolutely perfect CPR for the last 90 seconds, and they're still going really strong, so well done. We know that after about 2 minutes, your CPR gets a bit slower, not as strong, so you probably need to swap over. But you can see that actually we can come up with ways to deliver the training we were doing before, just face-to-face, which is quite exciting. Normally, to deliver CPR, we would need one of these mannequins. To deliver CPR training, we need one of these mannequins. They cost about £50 each. But actually, we could train people at home just by talking through the steps. So check for danger, call for help, as you saw in the video. And then we're not going to do anything with the airway or breathing at the moment because of COVID. So we're just, if they're not breathing, going to deliver the chest compressions. And you've had a go at doing it. Rasheen says that's me. And we've seen that you were doing it at the right speed. We told you about the right depth to do it. So 1/3 of the chest. And from that, you are empowered now to do CPR. It's no simpler than that, really. We also know that when that happens, you need to get somebody to go and find the nearest defibrillator. When the defibrillator comes, we stick the pads on the chest, but essentially you can follow the instructions. And if you want to, there's loads of videos on the internet. There's an app someone mentioned earlier to learn more about this. But I think what makes the CPR training effective is often the face-to-face touch. And actually watching a video on the internet doesn't do that, but doing the interactive thing where we can check your compressions does work for that. So I'm a little bit conscious of time. Just going to come up with a few more things to talk about in the last few minutes. So if you thought that was kind of exciting and interactive, then I'll show you. There is an app called Lifesaver VR. Again, I was going to show the video for this, but I issue had before. But if you Google Lifesaver VR, I'll post it. You can download this app, and you can Lifesaver app on your computer or phone, or you can download the Lifesaver VR app if you've got a Google Cardboard or something. And the great thing about this is it's actually shows you how to do CPR, but it's been produced by a really good film company, and it's quite graphic. And although that's a bit distressing in some ways, often people who know how to do CPR don't do it when it really matters because it's quite a distressing situation. So this VR video in particular is quite immersive and prepares you for that. So I'd highly recommend just downloading the Lifesaver or Lifesaver VR app and just watching that. It talks you through everything we've done today. It asks you what to do next and see how you find it, because you're not going to get to practice this often until the situation where you need to. And we know that in your lifetime, 1 in 5 people will actually have to perform CPR at some point. So it's a really important skill. I'm going to kind of wrap the talk up there, really. I know we've got a few minutes left. So hopefully what we've covered today is talked a little bit about being involved in public health initiatives as a medical student or other healthcare student. Talked a bit about why that's of value both to the community that benefit from the teaching, but also the skills that you can get to that are transferable to your clinical practice. Taking Restart a Heart as an example, we know that bystander CPR and using an automated external defibrillator are really simple skills that require little or no training. But if we can give people the confidence to use these skills, we can increase the chance of survival from out-of-hospital cardiac arrest. And we know that there's a lot of room for improvement in the UK at the moment, and also in the light of COVID-19, these skills are more important than ever before. If we can't deliver that training face-to-face, we're going to deliver it online. This is the first time I've tried the TCPR app, so if you've got any feedback on it, please do put it in the comments, and I'll send you the link so you can go and have a look at the Lifesaver and Lifesaver VR apps if you want a bit of fun after the session to develop your skills further. That's the end of my talk. Thank you very much for coming along. It's great to have so many people come and listen to my witterings. What I'll do is I'll open up for any questions, and if you've got any feedback on the TCPR and things, it'd be great to have that as well. So please do post some things in the chat if you're interested. Okay, so somebody says, can you tell me the name of the one to practice your skills? But the one that I would suggest you go and have a look at next is called Lifesaver VR from the Resuscitation Council. It's free to download on their website. Okay. How can we access the slides? I'll have a chat to Holly afterwards and see if we can get some of them sent out to you, perhaps.
Yeah, all sessions have been recorded. We're still establishing how they will go out, but
fantastic. Karina says, what do you think are the best first aid courses to take? Really interesting question. I guess it depends on what you're doing it for. So actually, for most of the general public, we don't need them to attend a full first aid course, really. We just, 8 minutes is all it takes to learn CPR and how to use a defibrillator. If you go and do a first aid course, there'll be things covered like choking, like managing bleeding, and normally a day or a 2-day first aid course should be sufficient for that. The sort of first aid courses that are more comprehensive will be accredited by often like the health and safety executive. So if you're looking to do it for work or something like that, then it's useful to find one that's accredited. And obviously all of this stuff is kind of covered through medical school as you go through. And after you've done basic life support, later on you would learn intermediate and advanced life support. And we would talk to you about drugs in cardiac arrest and things like that. And that all sounds very sexy and exciting, but actually what we know is that all the drugs that we give when someone's in cardiac arrest are actually not very effective. And actually the one thing that really makes a difference is the CPR and the defibrillator. So this is the kind of really important stuff, really. Just before, we've got some time for a few questions. So Bisma's asked a really good question here, which is it true that CPR can break ribs? A lot of people in my class didn't want to give CPR for that reason, but our teacher didn't confirm if it was true or false. Really good question. And actually, when we deliver the face-to-face training in the Restart a Heart, this is one of those kind of misconceptions or worries from the public that often puts people off doing CPR. So CPR, we're pressing on the chest to pump the heart, to pump the blood to the brain. And in doing so, there is a risk that we can break ribs. If you push in the middle of the chest at the right depth, which is always a bit more than you think, really, the chance of breaking ribs are lower. But actually, if you do CPR, there's a chance of breaking ribs. If I do CPR, there's a chance of breaking ribs. If doctors or paramedics do CPR, we can break ribs. And actually, at that point in time, without your CPR, that person's going to die. So we can fix broken ribs, but we can't fix a broken heart. So I can break ribs, but if you do break ribs, it's not you doing anything wrong. It probably shows that you're pushing the right amount, and if you don't break ribs, you might need to push a bit harder. So it's not the nicest thing to think about. CPR can break ribs, but that's not a problem, because at that moment in time, it doesn't matter, because we can fix that afterwards. Bisma, does that answer your question? Brilliant. Okay. So I think that is time on the session. Thanks so much for coming along. If you've got any other questions, I'll stick around for a little bit to answer them. But hopefully it's been a different perspective. If you're thinking about applying for a health career, you might take the opportunity to do some sort of public health initiative during the training. I would strongly encourage you to, and hopefully get a lot from it. Thanks very much.
Perfect. I just wanted to say thank you, James, on behalf of the Virtual Health Careers Conference. We weren't sure how we were going to be able to get an interactive clinical session into a virtual conference, and you have done that with great success, so thank you.
Well, it's the first time that I've tried delivering it online, and we have got a plan in the autumn to try and train every new undergraduate student at our university, not just medics or nurses, online. So you were very much guinea pigs. If you have got any feedback, please do let me know, because we'll be working on this as we go forward.
Perfect. Yeah, I'm at Birmingham, and I know we've just branched out the basic life support to more than just our medics, which I think is something that's really needed.
Right, well, enjoy the rest of the day, everyone. Thanks very much, and great to speak to you all. Thanks so much for engaging with the session as well.
Perfect. Thank you.